Are you gambling with your heart health and your sex life? Stop guessing and start knowing. Discover why the Apo B test is the missing piece in your sex life. Watch now. The Apo B test, also known as Apolipoprotein B test, is the blood test that measures the level of apolipoprotein B in your blood. Apo B is actually a protein that is bound to LDL or low density lipoprotein and VLDL, low density lipoprotein. Those are the bad cholesterol that when your doctor do blood tests, it shows LDL or VLDL. And these are the ones that bound together and create this waxy plaque that clog up your arteries. So think of it like the pipe in your sink, and it gets clogged up by the hair and the gunk, and then the water can't flow through. It's the same thing when you have cardiovascular disease, where the blood vessel had this waxy plaque that's stuck on the side of it and blood can't flow through. And that waxy plaque is LDL and VLDL. And what's interesting is that Apo B protein bind to the LDL and the VLDL. So it's actually Apo B is considered a better indicator of cardiovascular risk than your traditional cholesterol lipid panel test, because it directly measures the number of atherogenic particles in your blood. I find this very interesting, and I ordered this test on everyone that comes in to see me for ED. So essentially, Apo B take the LDL and the VLDL where they're going, and it only give rise to the LDL and the VLDL, and you won't find a good cholesterol with it, the HDL. When you measure this in the blood, it's a good indicator of your cardiovascular risk. So researchers have found that measuring the ApoB may directly predict your heart and blood vessel disease much better than your cholesterol panel, because it is ApoB protein carried 1-to-1 with the LDL. So having said that, it is a good risk predictor for people with metabolic syndrome or diabetes, because the LDL may be a little smaller or denser, and therefore a lipid panel or cholesterol panel may not show that accurately at this point. And what is the level you need to be at? Your apolipoprotein B 100 test should range between 20 to 400 milligram per deciliter. And if you are higher than 130 milligram per deciliter, you're at a higher risk of heart and blood vessel disease. Some cardiology guidelines recommend a target of less than 65 or 80 milligram per deciliter of ApoB, and they suggest goals for people between the age of 40 to 75 who take statin to be between this range of 65 to 80 milligram per deciliter. So what is a normal level of ApoB? For a man, it's between 66 to 130 milligram per deciliter, and for a woman, 60 to 117 milligram per deciliter. However, to note, there are conditions that make your ApoB test result higher than normal, such as pregnancy, having high cholesterol, and a kidney problem. And there are conditions that make your ApoB number lower than normal, such as having an infection like sepsis, having liver disease, and then taking estrogen. It only takes a couple of days for the ApoB test to come back. You get it from the veins normally, what you would get like for cholesterol and blood sugar. And if it is abnormal, then you should see your doctor and you should consider taking these recommendations. So if it is abnormal, try exercising for 30 minutes a day, eat more fruits and vegetables, like for instance, the Mediterranean diet, limiting fat in your diet and fried food, keeping your BMI at least under 28, avoiding tobacco products, and consider taking cholesterol lowering drug. However, if you change your exercise and your diet, you may not need to do that at all. And also, just know that changing your diet goes a long way, and discuss your blood work with your doctor. And how much does it cost for this apolipoprotein B test or Apo B test? It's around $100 if insurance doesn't cover, if you have to pay for it by yourself. But most of the time, insurance will cover it. I hope you find this helpful, considering asking for an Apo B test on your next blood work, because it may save your life, because this is the better indicator of your cardiovascular risk. And why am I talking about that with ED? Because if you have an abnormal Apo B level, and let's say you're on a statin and you're at 130, well, you know that your risk factors of cardiovascular disease is high. So you need to do something about it, because you're going to be at risk for not only ED, but also heart attack and a stroke. And maybe if you get this annually, especially for men over 40, you get this annually, you can actually see your risk factor for cardiovascular disease. And you can actually probably even see why you have ED by following this ApoB level and trying to keep it down by your diet and exercise. So it's a good test to get for risk factor predictor, and for something for you to get at least once a year. And I totally recommend it. I measure that in all my patients, and I see that it goes down with diet and exercise. Remarkably, you can see that change in about 2 to 3 months. So I hope you find this useful. I appreciate if you like, comment, and subscribe and share this. And just know that as a modern man, you can live more, love more, and be happy. And let's join me in the sexual revolution to regain our sexual independence without surgery or medication. I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay, and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect, and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instructions to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problem with circulation and heart health, This can also be a great way to prevent heart-related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED. With pre-recorded and live session being offered every week, I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.